We're supporting the efforts of the various agencies involved in delivering health to this area. And one key non-governmental organization is called Chirag.
You know, the Central Himalayan Rural Action Group, Chirag, was set up in 1987. We've been here now for 22 years.
Chirag have set up a much needed 24-hour facility in the form of the Chirag Himalayan Hospital, and we're supporting their efforts by providing doctors to run the hospital and the health services in this area. Today, 19th of January 2009, is a great day for health services of this area. The Chirag Hospital opens today, and we're very lucky that most of the staff is here. Let's go along and meet the staff. So it's just been inaugurated today. As you can see, the rangoli is still fresh on the ground. And Mr. Budani and Dr. Bisht, our doctor here for Chirag, and Durgaji, who is the ANM, Kanchanji here, who is a social worker, and also Kuntiji, who is a social worker, Lathaji, a brilliant singer and does so much here for the local people. Ram Singh Ji is our all-in-one. He does everything here, from stitching up minor things to dispensing medicines. And this here is Jennifer. Jennifer is our doctor, our volunteer doctor from England, who's here working with us. The hospital has been inaugurated just today, so bear with us, but come on a tour of the hospital. Emergency treatment room, continue. And over here is the main entrance to the hospital, which leads on to the outpatient rooms. The outpatient rooms over here, the pharmacy here, and Mr. Ram Singh, who doubles as a lot of things. And we can have a look here at the laboratory, a fully functional laboratory. And over here is the X-ray room. And upstairs we have the wards. So over here on our left are the wards, the nursing station in the middle, and on either side we have the wards, male and female wards, three beds each on either side of the nursing station in the middle. It's designed as a small cottage hospital. On the other side here is the area that has been set aside, which is going to become the operation theatre. And this is the space that we're using as a meeting room. We plan to have this hospital as an active place for education and training. That's Dr. Bish standing behind, and Dr. Jennifer here is our general practitioner who's come from England, from Chintan, and I'm just here. So we have to remember to look up, not down at the screen. Now, we are in the Himalayas. Yes, I mean, if we pick up the screen and point it out of the window, can you see where we are? Okay, so here we are. So what we're trying to experiment with is whether we could use this for medical conferencing.
You know, compared to what existed here 22 years ago, we have far more service providers here in terms of providing health services than existed 20 years ago. But the fact of the matter is that particularly for women and for children, there is a huge dearth of doctors. For example, there are no women doctors in 50 kilometers, in a 50-kilometer radius of this place. Now, culturally, to expect a woman who falls ill to go to a male doctor and subject to an examination, given our social cultural milieu, is very hard to imagine.
हाँ। आप 1-1.5 घंटे चल के आती हैं अस्पताल. This lady has walked 1.5 hours to this hospital, she says.
So our primary focus for the Chirag Hospital is, one, to provide emergency referral facilities, to look at specifically focus on the health of women and children. And the third is, and this cuts through everything that we do, is to provide quality health care at a reasonable cost.
This is another one of the consulting rooms, and fully equipped with broadband connection and computer. But the most important thing is the view. This is literally the consulting room with a view.